Hey everybody, welcome to Pick Dr. Osborne's Brain. It's another great Monday night. Today we're going to be talking all about vitamin B1, doing a crash course. Now, before we get going, you know the drill. Let me know who you are and where you're tuning in from in the world. Say hello. I like to know who I'm talking to. But we're going to really be talking about the ultimate crash course on vitamin B1. It's a really, although it's not considered to be, it's a very, very common nutritional deficiency. You know, a number of years ago in the early 1900s, it was responsible for thousands of deaths annually. And once cereal food products became fortified with vitamin B1, a lot of doctors now dismiss this deficiency as a potential player because a lot of our products, a lot of our processed foods actually have this particular B vitamin added in, but it's still quite a common deficiency. So I really wanted to give it the credit and the attention that it deserves. So that being said, let's talk about some of the major functions of vitamin B1 first and foremost. So we've got really three predominant functions for vitamin B1. Number one is it's responsible for generating a chemical called acetylcholine. Now, we'll get to that in a minute. It's also responsible for helping to produce or regulate blood pyruvate and blood lactate levels. And so if these are too high, if these things are too high, that can actually contribute to pain, muscle pain. Okay, muscle, two M's is a muscle. Acetylcholine deficiency can cause depression and anxiety. I want to make this make sense for you because a lot of what we see in terms of vitamin B1 deficiency is actually drug-induced, and we'll talk a little bit more in detail about that. But again, acetylcholine, which can lead to depression and anxiety. Pyruvate lactate levels can cause muscle pain, and then neuropathy is another problem associated with vitamin B1 deficiency. And one of the forms of neuropathy that can actually be increased is epileptic or seizure problems. So if you understand kind of, what I'm trying to do here is categorize the three big functions of vitamin B1 for you. So acetylcholine production, the regulation of pyruvate and lactic acid, and then neurologically speaking, it helps in the production of the myelin sheath, and a deficit of it can lead to a neuropathy contributing to the epileptic type of disorders. Now, there are a number of other symptoms, and I'll put a slide up here for you on the symptoms of vitamin B1 deficiency, but fatigue. And one of the reasons why, as with all of the other B vitamins, they help us generate energy from the food that we eat. So the carbs, you know, processing carbohydrate into energy requires vitamin B1. We said a minute ago, muscle pain. So we're going to write that up here under symptoms as well, because a lot of times muscle pain is not really classified as a disease. So you go see your doctor because you have aches and pains. And generally the first rule of thumb is you get a non-steroidal anti-inflammatory drug to help with your aches and pains. But again, if you know that this type of symptom can be caused by vitamin B1 deficiency, it might help you think twice about it. Anxiety, I mentioned that earlier as well. Anxiety, if you struggle with anxiety and you don't know why, a lot of times vitamin B1 deficiency has a role to play in that. And as well, neuropathy we mentioned as well. So again, these are all symptoms associated with vitamin B1 deficiency. High blood pressure as well as an elevation in heart rate are two symptoms that are notorious. I'm going to put depression right here because I already mentioned that, but increased heart rate as well as increase in blood pressure can happen as a result of vitamin B1 deficiency. By the way, vitamin B1 is also known as thiamine. So I mentioned earlier that a lot of our processed foods now are fortified with thiamine. When you read a food label, this is the term. Thiamine is a synonymous term for vitamin B1. So you might not see vitamin B1 on the label. You might just see thiamine or thiamine hydrochloride. And if you see that, you'll know that that is actually vitamin B1. So these symptoms all pretty well linked to having a deficiency. And if you're experiencing any of these types of problems, you know, one of the first things that you should do, especially if you're being medicated for these symptoms. So again, if you're being medicated with pain relievers, if you're being medicated with anti-anxiety or antidepressants, if you are being medicated with drugs like Lyrica or the gabapentins to help with neuropathic or neurological pain, if you're being basically, if you're having your blood pressure suppressed, like very, very important that you ask your doctor to measure your vitamin B1 levels. Now, the best way to do that is to measure them. Measure levels in the cell, not in the blood. If you measure in the blood, you're going to get, unfortunately, you're going to get an inaccurate result. Thiamine levels in the blood are not a reflection of thiamine levels in the cell. And a lot of times the liver redistributes vitamin B1 to the blood, so you can have what looks like a normal level in your blood, but it's not making it to the cell where it actually does its work and does its job. There is another test, ETKA, because a lot of doctors, when you say, hey, yeah, doc, run my intracellular level, they'll look at you like you got horns growing out of your head. But this might speak more on some of these doctors in some of their terms. ETKA, that stands for erythrocyte transketolase activity coefficient, or actually, I put it here backward. If you ask or ask for that particular test, they may look it up in their lab book, and they may be able to find it, and they may be able to order it for you. So if you ask for that one instead of the serum B1 or ask for it in the cell, again, either one of these two would be a better way to try to detect a vitamin B1 deficiency and whether or not it's part of your problem. So going back to what I said a minute ago, so those symptoms of vitamin B1 deficiency, generally speaking, lead to a number of different medications that doctors might prescribe, because the symptoms for the large part are basically disease-like states or syndrome-like states that typically medicines are given for. So, you know, for example, when it comes to anxiety and depression, oftentimes one of the first meds that gets pulled out is your SSRIs, your selective serotonin reuptake inhibitors. These are medications like Paxil and Prozac. So again, your antidepressants. Sometimes doctors will use like clonazepam or other anti-anxiety medications. Sometimes they'll use what are called tricyclic antidepressants, which is another class of medication. So again, I want you to kind of follow my logic here. So this is step one. Okay, over here you're going to get medicines like NSAIDs. Here you might get anti-epileptic medications, so medicines for epilepsy. Okay, but the other thing here that I want to kind of make note is the pyruvate and lactate levels will affect not just the muscle, they'll also affect the cardiac tissue. And so this is one of the reasons why we can get an increased heart rate and an increase in blood pressure. Acetylcholine deficiency will also affect cardiac tissue, because your heart is basically, your nervous system communicates to your heart through the neurotransmitter acetylcholine. So when you have acetylcholine deficiency, or you have an elevation of pyruvate and lactic acid buildup, you can get chest pains, you can get cardiac symptoms of increased heart rate and increased blood pressure. Now, if this were to happen for most people, the side effect of this is going to be high blood pressure or high hypertension or congestive heart failure, which is one of the disease states that thiamine can cause. So I'm going to abbreviate that as congestive heart failure. So if you've got swelling, so I'm going to show you another slide of diseases, linked to vitamin B1 deficiency. And, one of the pictures here, you can see the foot here in this image is this very, very swollen foot. And that's called edema, right? And so if you basically can put a finger into your leg, and when you pull your finger away from your leg, you leave a little indentation that stays there for several seconds, that's fluid pooling in your lower extremity. The name for that is edema. It's a sign, or it can be a sign, of congested or congestion in the heart. So congestive heart failure, again, and the number one medicine used or prescribed for congestive heart failure is diuretics. So if we look at, okay, what does a diuretic do? It causes vitamin B1 deficiency. That's the problem, right? Because if you have this problem, this pathway of this problem, and your doctor pulls out the diuretics but never tests you for vitamin B1 deficiency and puts you on a diuretic The diuretics actually cause vitamin B1 deficiency. It's a major, major problem today, and there are a number of different scientific research articles and studies that have shown that people hospitalized for congestive heart failure, that a large percentage of these individuals actually don't have a heart problem. They have a B1 deficiency problem that is causing the heart problem. And the medicine that's being used to treat their problem is actually creating a bigger part of their problem. So it's very, very important to understand that, because if you've ever been diagnosed with congestive heart failure, high blood pressure, or if you've ever had a kind of a recurring elevation in your heart rate, this is something that you definitely want to explore so that you don't make it worse. Because if you make it worse, the name of vitamin B1 deficiency disease is called Beri Beri. Now, Beri Beri, there's two forms of it. There's a wet form and then there's a dry form of Beri Beri. And if we think about this intelligently, the wet form is the heart. It affects the heart, and that's part of what this is doing here, okay? And then there is a dry form that affects the nervous system, and that's what's happening over here. But it's also in part of what's happening over here. So remember, there's a couple of kind of dualities or overlaps. You can have a heart problem being caused by the acetylcholine issue and the pyruvate issue. You can have a nerve problem being induced as a result of the B1 and neuropathy as needed for the myelin sheath, but also as a result of low acetylcholine. Remember, acetylcholine is a neurochemical that drives most neurological processes. So when your brain and spinal cord are trying to talk to your organs, or when they're trying to talk to your muscles, the message that your brain and spinal cord use to communicate is acetylcholine. And this is why low levels of B1, after causing low levels of acetylcholine, can lead to nerve problems, but also lead to heart problems and muscle problems. So there's a lot of overlap in what happens as a result of just this one chemical. But then again, these are two other very important functions as well. But if you've ever heard the term Beri Beri, there's wet Beri Beri, which is your heart. There's dry Beri Beri, which is your nervous system. And then again, there's epileptic seizure problems that can come out of this. Now, I was in the middle of a thought here and I got distracted. I was talking about epilepsy. The common treatment for epilepsy are the medications. There are a number of different anti-seizure medications. The problem with these medicines is they can also cause B1 deficiency. And so not just B1 deficiency, they've also been linked to B12 deficiency, which can also cause neuropathy. So sometimes what happens is you have a neuropathy caused by B vitamin deficiency, and then you medicate the neuropathy, creating a worsening of the B vitamin deficiency, and the problem really doesn't ever get fixed. So it's important to understand these different parameters, because if you don't, and again, you're being medicated, you could actually end up with more of a problem. Now, non-steroidal anti-inflammatories, I'm going to come back to the middle. So if you're chronic pain, you're on non-steroidal anti-inflammatories, it's important that you understand that although these medicines don't cause, per se, a vitamin B1 deficiency, they do damage the stomach and the small intestine. Now, remember that where vitamin B1 is absorbed predominantly is in the small intestine. The vast majority of its absorption occurs in the small intestine. So if you've got enough chronic NSAID use, theoretically, you could damage your small intestine and subsequently inhibit your ability to properly absorb vitamin B1, leading to the problem. There's no medical research that shows that correlation, but again, theoretically, it is plausible. But beyond that, NSAIDs do lower folate, and folate deficiency causes neuropathy, okay? And folate, so not just folate, but also vitamin C. And vitamin C deficiency can contribute to neuropathy, but also iron. And iron deficiency can contribute to a buildup of lactic acid because not having adequate iron means your muscles don't get adequate oxygen, so you go into a state of anaerobic metabolism, and the byproduct of that is lactic acid. So it can actually increase or further deteriorate the problem. So I'm hoping you guys are seeing some really valuable connections in this. I want to pull up another slide for you, though. I want to talk about what causes vitamin B1 deficiency, because many of you, that's kind of the next logical question, right? So alcohol is one of the big ones. There's actually something called Wernicke-Korsakoff disease, which is an alcohol-induced vitamin B1 neuropathy, deficiency neuropathy. So if you're a chronic alcohol user, and I'm not talking about an alcoholic, I'm not talking about the guy or the gal that, pushes back a fifth of vodka every night. I'm talking about even if you're drinking 1 to 2 glasses of wine every night, saying that that's moderate, remember that alcohol is deteriorating your vitamin B1 levels. Alcohol is very, very hard on vitamin B1. High processed food diet. Although we do have food fortification laws in the country, and these food fortification laws are largely based on grain. If any of you have read my book, No Grain, No Pain, I wrote about this in detail, but in the early 1940s, 1943, the United States government banned the sale of grain unless you fortified it with vitamin B1. And that was because when you combine vitamin B1 and vitamin B3 deficiency diseases, about 8,000 people every year were dying from the deficiencies of these diseases because of processed grain-based foods. So cereal manufacturers actually came in and they started to fortify, under law, they had to fortify vitamin B1 into grains. But again, not all processed foods are grains. Some processed foods don't have grains in them, and there's no B1 requirement for fortification in that regard. So high processed food diets, especially your high carbohydrate based processed foods. So anything that's high in carbohydrate that's processed, especially like your sugar based products. And even now today in the gluten-free market, some of the products that are high carbohydrate, like your tapiocas, your cassavas, your high carb starch flours that don't have vitamin B1 added into them can become depleting of vitamin B1 if you overconsume them. Remember, for every carb you eat, you need vitamin B1 to properly break that carb down and convert it into energy. So if the food you're eating is highly processed and you've destroyed the vitamin B1 in it, then it's not going to be very healthy for you, and it could end up creating a problem. And that's why the third thing on this list is excessive carbohydrates and excessive sugar. These are very, very depleting of all B vitamins, but in this case, vitamin B1. Gut-induced GI damage. I mentioned that earlier, the non-steroidal anti-inflammatory, we know that GI damage can occur as a result of taking this type of medication. We also know, for example, that not just non-steroidal anti-inflammatories, but steroids, when you combine a steroid with an NSAID, the effect is synergistic on gut damage. So you get a greater degree of gut damage when you combine a non-steroidal with a steroidal. And so that's another avenue of why you might have a GI inflammatory issue. Now, there are also diseases that basically manifest as GI inflammation. So, for example, those of you with gluten issues, right, we've got celiac disease and gluten sensitivity, and that can create villus atrophy, which makes it very, very hard to digest and to absorb the vitamin B1 from the food that you're eating. Aside from the fact that the gut is atrophied, the villi are atrophied, there's an inflammatory damage that can impede or hinder the process of digestion. You also have GI diseases like Crohn's and ulcerative colitis. Those are other forms of inflammatory bowel disease that can potentially affect or impact your ability to digest and absorb the nutrients from your food, although those are a little further south in the large intestine, and where we see most vitamin B1 absorbed is in the small intestine. So celiac is going to be a much greater potential impact factor for creating a vitamin B1 deficiency than, say, Crohn's or ulcerative colitis. But the problem with Crohn's and ulcerative colitis is they cause chronic diarrhea, so nothing stays in the GI tract. It doesn't have time to get absorbed because the diarrhea just keeps coming out, and that makes it hard to absorb the nutrients from food because of really, really rapid transit time. Now, one of the other things that can cause vitamin B1 deficiency are medications, and I'm gonna actually talk about that in a little bit greater detail here in just a minute. So I'm gonna come back to that one because I think it's really important you understand that one. And then excessive coffee and tea. Now, those of you listening right now, raise your hand if you drink more than 2 cups of coffee a day. Just raise your hand and be honest with yourself. Say two cups or more. Just type that in and let me know kind of who I'm talking to. But if you're drinking more than 2 cups a day, you're who I'm talking to, okay? You're who I'm talking to. Excessive caffeine, 2 cups of coffee a day is about 240 milligrams of caffeine, which is equivalent to enough caffeine to create a diuresis. Remember I said earlier that diuretics cause vitamin B1 deficiency? Well, guess what? Caffeine's a diuretic, and that doesn't mean you can't enjoy a cup of coffee occasionally or even a cup of coffee a day, but if you're over consuming that coffee, if your cup isn't like that 6 ounce, but it's more like that big stop and go or big convenience store 72 ouncer that gets, free refills every day, like you've got a problem with coffee, and that's going to land you into some hot water and some trouble. So excessive coffee and excessive tea. Tea again has caffeine, but the quantity of caffeine in tea is much lower. So tea drinkers can get away with more than a couple of cups a day without overshooting their caffeine to such a great degree. Now, another scenario that can create a vitamin B1 deficiency is if you've had surgery, especially like gastric bypass surgery, where you, again, what you're doing is you've had a surgery that reduces transit time and reduces the ability for you to degrade your food or break your food down. So you've had a gastric bypass, you are at risk for a vitamin B1 deficiency. And if, again, if you're considering this type of surgery or if you've already had it, you should have had an interview with a nutritionist explaining all of the detrimental nutritional related side effects to having that surgery before the surgery. That's called informed consent. If that conversation didn't happen, you need to make sure you go to my YouTube channel and check out more of my archives and more of my crash courses on the vitamins and the nutrients, because it's important that you understand that any kind of surgery that damages or shortens or basically shortcuts part of your GI tract is going to lead to nutritional deficiency, and it's going to lead to health issues later down the road for you. So if you don't know about it, there's no way to get tested. See, it's important that you know, because even if you had the surgery, now you can get tested adequately, and that can be justified every year, and your doctor can run those tests, and then you can supplement accordingly to make up for the loss of those particular nutrients. Okay, now I want to move into the medicines that cause vitamin B1 deficiency. So I've got a slide prep for you on that as well. So this is a list of some of the different medicines that we know vitamin B1 deficiency, or rather, these are some of the medicines that we know that can cause a vitamin B1 deficiency. And some of these you've heard me already mention. So diuretics being one of them. Now, diuretics can cause more than just a vitamin B1 deficiency, but I think it's important that you understand this correlation. And I'm going to get a different color here to kind of draw some lines for you. So remember what we said earlier, B1 deficiency creates a lower level of acetylcholine, creates an increase in lactic acid, and creates neuropathy. Okay, so any drug that causes a deficiency of vitamin B1, if the drug is being used to treat the vitamin B1 deficiency symptoms because the vitamin B1 deficiency was never adequately assessed, and the doctor instead just told you, oh, you're just depressed, or it's just family history that you have congestive heart failure, there's nothing you can do about it, therefore I'm going to give you a diuretic, and then that makes it worse. Or, oh, you have pain, oh, you're just getting older, let's give you some medications. Although they don't cause a vitamin B1 deficiency, they do cause symptoms that mimic a vitamin B1 deficiency or that are very, very similar. Or in this case, anti-epileptic seizure medications can cause a neuropathy, can cause these other problems. So it's important that you see those correlations, because if you don't see those correlations, again, what ends up happening to a lot of you, and the reason why the average 35-year-old in the United States is on 5 or more medications, is because you go in with one symptom, you get a drug. You take the drug long enough, the drug creates a nutritional deficiency that creates a new set of symptoms. So now you've got these new symptoms. The doctor says, oh, well, let's give you another medicine. So then he gives you another medicine, and that medicine has a different side effect and a different depleting capacity, and that creates a series of other symptoms or problems associated with nutritional deficiency, and you just end up adding one on top of the other. Basically, your doctor ends up treating your medicines. They first started out treating your symptoms, but later they end up treating the side effects of your medicines. And then before you know it, you're on 5 or more pills, and you're really, really struggling to try to function, because when you're on that many different drugs, that's all got to go through your kidney, or that's all got to go through your liver. Your body's already overwhelmed with environmental toxins and food-based toxins and other problems. So where's the end to that scenario other than just more medications without more solutions? And we don't work that way. In functional medicine, functional nutrition, you don't want to attack the symptom, because if you attack the symptom with a drug, you're not really solving why the problem exists. You want to identify why the problem exists, and then from there address that issue. So if you are having foot swelling, or your foot's swelling up, and it's because your vitamin B1 levels are low, no amount of diuretics is ever going to fix the vitamin B1 deficiency. And as a matter of fact, they're only going to mask it, giving you a false sense of security and confidence. And as you mask it, what ends up happening is the damage continues to compile. And so more and more time goes by, and you end up continuing to struggle. So We mentioned seizure medications cause vitamin B1 deficiency. One I didn't mention, and this is, I really want to shine a headlight on this one, is ladies, if you've ever taken an oral contraceptive, just type in the box OC. Just put OC in the box for oral contraceptives, because oral contraceptives, and what I mean, estrogen, basically, okay, can cause vitamin B1 deficiency. So how many of you that typed in OC below have ever been tested for vitamin B1 deficiency? You know, the average, you know, in industrialized countries, the average, you know, 18 to 20-year-old, you know, a lot of them get put on birth control, whether it's to actually control an unwanted pregnancy, or whether they're on birth control to control acne, or whether they're on it to control their symptoms of their premenstrual dysphoria or dysfunction. They're on it for a reason, right? And so if that reason creates a vitamin B1 deficiency, and, you know, and it leads to this whole plethora of different problems, and a lot of women that have been taking estrogen for a long period of time end up with depression and anxiety as a side effect to some of the estrogen-based medications. So again, you take the medicine, and then you end up with this problem, and then you end up treating this problem with a new drug, right? And it just snowballs. It continues to go from there. So again, this is such a common medication that's dispensed. I mean, I've heard the ridiculousness on TV where, you know, I think I'm doing a direct quote here when I say, there's no medical reason for a woman to have a period, which is the most ludicrous statement I think I've ever heard, you know, supposedly coming from an intelligent body of doctors who are pushing a pill down throat. There is a medical reason to have a cycle. There's a very, very important medical reason to have a cycle, and we don't just want to not have it. If you're having a terrible cycle, if you're having a lot of pain, or if you're having a lot of cramping, or if you're having headaches, or whatever, hyperhydration, you know, the symptoms, excessive craving, irritability, mood swings, like all those different things that can happen with a PMS type of issue, you got to ask a deeper question. The answer is not that you're estrogen deficient. The answer is that estrogen will chemically manipulate your body's reaction so that those symptoms might be managed or might be mitigated. But the reason you're having the premenstrual issue oftentimes has something to do with what's in your diet, what you're eating. It's just that, again, doctors don't take nutritional classes, so they're really not qualified in that regard to speak about nutrition with any great degree of intelligence, and so they usually just dismiss it. And then you're on that estrogen-based medication for 5 years, 10 years, 15 years before you get ready to start your own family. And now you've got that many years of nutrient depleting actions. Now, just as a side note here, estrogens deplete B2 and B6 and zinc as well. So it's not just vitamin B1. Vitamin B1, yes, they do deplete that, but they deplete B2, B6, and zinc as well. So you're not just, you know, running the gamut of one B vitamin deficiency problem, you're running the gamut of multiple issues. And then we also have, as another medication, we've got antibiotics. So how many of you been on antibiotics? Raise your hand if you've been on antibiotics. Type in AB in the feed if you've ever taken an antibiotic. Okay, antibiotics can cause vitamin B1 deficiency. Now, I'm not saying don't take an antibiotic. If you've got an infection and you're running a fever and your life is in jeopardy, take the darn antibiotic. However, that being said, if you're chronically back to the doctor being treated for chronic recurring infections and they're not getting better and they just keep throwing different antibiotics at it and you're still not getting better, that's who's at risk for this problem. Remember that when you take an antibiotic, you knock out your gut flora. Your gut flora produces B vitamins. They can produce vitamin B12 and B1 and B2 and B3 and B6. So they're very, very important for you to be able to make B vitamins. And if you knock them out, you're going to deplete your body's natural ability to somewhat metabolize your food into certain B vitamins as well. And that happens in your microbiome. So don't destroy your microbiome without a just reason, a life-threatening reason. Antibiotics are used way too, well, they're not used judiciously enough. I'll just leave it at that. Now, another medication that we know can deplete vitamin B1 is metformin. This is a very common medicine, and I'm going to kind of give you a scenario here. Metformin is a diabetic medication, so it's designed to help improve blood sugar or insulin sensitivity. Now, metformin will cause vitamin B1 deficiency. And again, why would somebody be taking it? Most of the time, diabetics are on this medication. So if you've ever been diagnosed with diabetes, generally you get metformin. And so metformin, understand, it causes B1 deficiency, but it also causes B12, folate, and CoQ10 deficiency. Okay, now all these being diminished, think about this if you're diabetic. These all are necessary to generate energy from carbohydrates. So what's the problem in diabetes is you can't generate energy from carbohydrates. So the doctor gives you a drug to kind of bypass getting the sugar from your blood into your cell, but then it's the very same drug is depleting your body's ability once the glucose gets into your cell to take that glucose and convert it into energy. So you basically end up ramming the glucose from your blood into your cell. And since your cell can now not deal with the glucose because your cell has been depleted of key B vitamins that are responsible for doing that, you now have toxic levels of glucose coming into your cell with nothing to do with them other than for them to damage your intracellular machinery. So this is a bad scenario, bad outcome. But coming back to this one right here, many women that are on oral contraceptives, some of them are put on oral contraceptives because of a condition called PCOS. So we'll just write over here, let's use a different color. So you got PCOS, which is basically diabetes of the ovaries, if we're really oversimplifying it, but that's what PCOS is. A lot of women get prescribed oral contraceptives combined with metformin. So now, okay, if you've ever been diagnosed with PCOS, and you've been given both of these medicines, just type in PCOS below and let me know who you are. But this is a very, very common kind of pattern of medications that are used for PCOS. Now, again, if this is diabetes of the ovaries, and now you're taking two different kinds of medications, both of them that deplete your B vitamins, your B1 twice, your B2, your B6, your B12, and your folate, which is a B vitamin, how are you going to deal with that glucose? How are you going to deal with that carbohydrate? It's going to be very hard for your body to do that. Now, on top of that, zinc is necessary to make insulin. So you're taking that oral contraceptive, depleting zinc, you're depleting your body's natural ability to produce its own effective insulin. And so now you've got more than one problem. You've got an potential insulin deficit issue combined with an inability to have adequate B vitamins to convert the glucose into energy. And remember, the buck stops at energy. If you can't generate energy, what are the symptoms associated with your body not being able to metabolically drive energy production? Fatigue, brain fog, lethargy, weight gain, elevation in triglycerides, liver damage, like the list goes on and on and on. And then your body basically becomes a petri dish for sugar because you can't process the sugar, it's in you. And so what does sugar feed? When I say petri dish, I mean, it becomes literally a petri dish for yeast. Yeast now can grow because they've got plenty of food substrate. Abnormal gram-negative bacteria can grow because they've got plenty of food substrate. I mean, this is one of the major problems associated with most people's chronic health issues or situations, is because they get put on medicines over time that deplete their ability to handle sugar, so their body becomes that petri dish. And again, you don't want your body to be that petri dish. So back to B1, again, metformin, commonly used in PCOS, but also used in diabetics. Now, coming back to this, what's one of the side effects of diabetes? It's the neuropathy, right? So you've got a diabetic neuropathy, and sometimes it's caused by the sugar, but neuropathy can be caused by B vitamin deficiency, as is the case with vitamin B1. But B12 and folate can also cause, or deficiencies of B12 and folate can also cause a neuropathy. So again, I hope you're seeing all these interconnections. It's really what I hope you walk away from today, is seeing the interconnectedness of how taking one very, very critical, very, very essential B vitamin, okay, and by not analyzing the potential for this B vitamin to create these problems, but instead medicating these problems, and the medications lead to secondary and tertiary nutritional deficiencies that create the same problems and also create new problems. And then the new problems get medicated with more drugs that create more nutritional deficiencies ad infinitum, right? We keep going on in that circle. And that's what I want to try to help you prevent from happening to you. So Let's go to the next slide. Let's talk about how we can get some vitamin B1 in our life. Now, best way to get vitamin B1 is animal meats. Now, many of you who are vegetarian or vegan, you might be saying, well, how do I get it if I'm in that regard, if I'm not eating these things? You can get B1. There's almonds, and you can get B1 from peas. You can get B1 from spinach. There certainly are plant-based sources of vitamin B1, but they're not as rich as these three here: the beef, the pork, the organ meats. So if you can do the organ meats, if you're not a vegan or if you're not a strict vegetarian, these are your bang for pound, these are your sources of vitamin B1 that are definitely going to be much, much higher for you. Can we go to the next one? Okay, now I want to show you one more slide here, which is how thiamine is destroyed in food processing. So now you know how to get it. Understand that any processed food that you eat, even if you see this term thiamine, I want you to understand that there are different things that deplete or that destroy the thiamine. So they may even be adding the thiamine into the product, but if they're using sulfites as a preservative, which again is wine, is sulfites, and then a lot of your other processed-based food items are basically like dried fruits, for example, sulfites. If you're eating the dried fruits, look at the back. You're looking for the word sulfite. If you see the word sulfite, put it back on the shelf. Get you dried fruit that doesn't have any sulfites. Food radiation, and so many restaurants radiate the food before they serve it. So food radiation can destroy the vitamin B1 content. And so even if you're eating those other foods that I showed you a minute ago, the beef, the pork, the organ meats, but it's being radiated, you're going to destroy some of the valuable thiamine in those products. And then in addition, high temperature cooking. So if you're eating fried, and that includes air fried, it's still high temperature cooking. You have the potential to destroy thiamine. Now, there's one other thing that's not on this slide that I'm going to bring up, and that is the alkalinization of food. So if they add an alkalinizing agent to the food, you can also neutralize thiamine. So it's important to understand that as well. So those are the ways that thiamine can be destroyed in food processing and or cooking. So it doesn't mean don't cook your food. I know there's a bunch of people out there talking about how the raw food diet is the best diet since sliced bread. By the way, sliced bread isn't the best thing since anything, but neither is the raw food diet. There's a wisdom to why we cook certain foods. So don't think that you need to eat everything raw. And just because you might cook something at higher temperatures doesn't mean you're losing 100% of the thiamine in the food. It just means be cognizant to not overcook your food, to not burn your food, to not eat everything from a fried vat. And think that you're going to get adequate thiamine from those sources. So all that being said, I'm going to open the floor for questions that any of you have. I'm going to take all of your thiamine questions today. So, okay. Oh, man, we got tons of you chiming in tonight. So let's see. I love that. Andrea says, I've had brain surgery, kidney cancer, and seizures. Since eating healthier and exercising every day, I've slowed the seizures down, and the kidney cancer has not returned. That's fantastic, Andrea. Thank you so much for sharing that. Hopefully, somebody will take that story and maybe they're struggling and maybe they'll run with it as well. That's fantastic. Let's see here. I don't know who MC2963 is, but 200 plus ounces of iced tea a day, homemade 10 to 15 bags. You're overdoing it. It's you may not have a problem today, but you're asking for a problem tomorrow. So I highly recommend that you take that dose down a notch, a couple of notches. Let's see. Naomi's got a question here. Let's see. What happens when you have stopped taking vitamin B thiamine for a few years, prescribers by the doctor, normal GP, and have now started a vegetarian, plant-based, organic diet? What happens? I don't know. But if you're on a plant-based, organic diet, vegetarian, there are a few nutrients that you should, definitely get checked out. Now, that just tend to be lower in a plant-based diet. Vitamin B12 is one of them. Certainly, vitamin B1. We've also got amino acids like glutamine and methionine that are very, very important that generally tend to be lower in a vegetarian diet. So, zinc generally tends to be lower in a vegetarian diet. So it's really a good idea if you're on and whether you're vegan or whether you're gluten-free, doesn't matter. If you're on any kind of food-based restricted diet, it's not a bad idea to visit with your doctor and have a nutritional deficiency testing done at least once a year. People that come to see me, I like to test them twice a year so that we can keep up what their dietary needs are on an ongoing basis in an accurate way so that we can avoid a problem, because problems are a lot easier to resolve if we can stop them from happening versus waiting for the problem to come and then worrying about what to do about it. Herbal tea is not the same thing. Naomi wants to know, what about herbal tea? Herbal tea, if it's decaffeinated, you don't have to worry about it. We're talking about caffeinated versions of tea, which is your, like your traditional black teas, or your green teas are caffeinated, or some of your white teas are caffeinated. But your true herbal tea, like chamomile or lemon balm, that kind of thing, those are naturally decaffeinated. Yeah, 1 cup of green tea every morning, that's fine. I don't think you're going to overdo the caffeine. Again, I'm talking going back to like MC2963 says he drinks, he or she, I don't know, but 200 ounces of tea with 10 to 15 tea bags. That's too much. You're gonna end up creating a problem. There's actually tea is unique in this regard, that tea has some agents in it that are anti-thiamine factors. There's certain vegetables that have anti-thiamine factors in them, and tea is one of them. The betel nut is another example of a food that has natural thiamine inhibitors in it. So with that much tea, it wouldn't surprise me. And I've seen a number of people with heavy tea usage that have a lot of the symptoms here, and when supplementing with vitamin B1, do much better. Let's see here. How bad is the medical profession? It's shocking. Well, it's not a question, but a comment. And I agree, Claire. It's really, to me, it's quite alarming. I mean, this is not a damnation to any and to all doctors in hospitals. I think there's some really great professionals that are out there, but I think as a whole, our system has really failed to educate them about the important things that actually can create or cause disease. And in lieu of teaching them how to dispense medicines to suppress the symptoms of disease. To me, that it's not that medicines can't be used or that can't be helpful. It's that we don't look for the origin of the problem. We'll never find it. And if you don't find it, no amount of medicine is ever going to resolve it. Let's see. Catherine wants to know, are blood tests a reliable measurement of B1 levels? I test within the reference range. No, blood tests, not so much. Again, I said this earlier, intracellular, measure in the cell, or erythrocyte transketolase activity coefficient is another good test that you can ask your doctor to run. It might give you an indicator as to whether or not you have a vitamin B1 deficiency. A few years ago, I was on it for years, stopped it now for, okay, nope, not a question. Okay, keep going. No question there. Oh, there we go. I missed the first half of this. Does vitamin B1 hurt people with celiac? No, vitamin B1 doesn't hurt people with celiac, but vitamin B1 deficiency can be caused by celiac disease. So if you are celiac and you've had, years of gastrointestinal inflammation and damage, and you haven't been checked for B1 deficiency adequately, it's definitely something I would recommend that you do. In terms of getting it figured out. But taking B1 as a supplement doesn't hurt you. It's a water-soluble vitamin. So from that perspective, very high amounts really they're relatively non-toxic. There's no great reports on vitamin B1 toxicity. So it's one that's very safe to take, and it doesn't generally cause harm. Let's see. I agree. My doctor dismissed that my improvement with hypothyroid disease and other autoimmune conditions was linked to my change in diet, going grain-free, gluten-free, and going totally organic. He basically looked at me as if I'd said something preposterous. Yeah, that's pretty common. I'm glad you shared your story, though, because there's so many people that are probably tuning in tonight that have that same type of experience that, might benefit from your experience as well. Supplementation, I like it. So we didn't really talk about that, did we, Sharon? So what about vitamin B1 supplementation? So a couple of good ways to take vitamin B1. And my favorite formulation is the one I created. It's called Ultra B1, and it doesn't just have vitamin B1 in it, but it has vitamin B1 plus some other nutrient cofactors that help vitamin B1 do its job. But there are a few let's make some room somewhere here. There are a few types of vitamin B1 that can be looked for in supplements if you're interested in trying to supplement. And so one of them, and my favorite, is the fat-soluble version, Thiamin. So if you see this term, this is a good one, Thiamin. Then there's also Thiamine HCl, hydrochloride, is a pretty decent brand or form. And then there's also thiamine mononitrate, which is another good one. So if you're seeing these on the label, these are generally pretty good forms of thiamine supplementation. You know, I like Thiamine best because it can be absorbed and pushed through the body a lot easier than these other forms, but these other forms aren't bad either. So if you're talking about supplementation, those are good ones. Now, if you're talking about how much to take, it depends. If you're really deficient, 50 to 150, even as much as 200 milligrams a day. So, you know, if you want a supercharged dose, right? Anywhere between 50 and 150 milligrams per day. Now, look, if you're going to do something like this where you're getting up in the higher levels, my advice is, again, get with your doctor, have these tests evaluated so that you have an idea of whether or not it's working, whether or not it's being absorbed. Thiamine, unlike vitamin B2, when thiamine comes out in the urine, it doesn't discolor your urine yellow. So if you've ever had like a multivitamin where you've taken a multivitamin, you pee, and it's very, very yellow, that yellow is vitamin B2. And so vitamin B1 doesn't do that. It doesn't turn your urine yellow. So if you're taking it by itself without any of the other B vitamins, you just don't know whether it's being absorbed outside of hoping for the best. So, but you can, again, you can monitor it with your doc. That's a super dose, kind of marginal, kind of steady state doses, anywhere between 5, and 20 milligrams a day. Really safe, can be very effective at vitamin B1 supplementation. Let's see. Louise says, I have something wrong with my white blood cells and was told I needed more vitamin B and folate. Since taking more, I feel great. Now the doctor says I can stop taking extra vitamin B. What should I do? I'm scared. I feel great with good energy. Look, supplements are designed to be supplements. They're not designed necessarily that you take them for the rest of your life and be dependent upon them. Ultimately, your diet should comprise the vast majority of the nutrients and make you nutritionally sound. Generally, in my experience, and I don't know how true this is, but I could argue very much that I probably run more nutritional testing than anyone in the world. I mean, we have done thousands and thousands and thousands of nutritional tests, from everything from intracellular analysis to all of these other different varying forms of looking at nutrients. And what I have seen as a trend in all of that experience over the last 20 years is that people that have their diets and their lifestyles dialed in really tight. That means organic food. That means eating for their own genetic potential. That doesn't mean necessarily eating, cheating on the weekends, but eating really, really solid and eating really, really well. Those people tend to need less supplementation in their diet and in their lifestyle. Now, some of this is very, very unique as well. We do sometimes see people eating really, really well, and they still have a predisposition to developing certain deficiencies. And so in those cases, we supplement them. But generally speaking, in your case, Linda, it's not bad advice. Your doctor didn't give you poor advice in terms of, I'm sorry, Louise, that was your question. He didn't give you bad advice and saying, hey, try getting rid of it, try taking it, you feel better, but now let's try tapering down and weaning off and see if you still feel better. And that tells us whether or not your diet is adequate or your digestive tract is adequate at getting the nutrients absorbed. Okay, Linda has a question. If you think you have B vitamin deficiencies, can you take a Bcomplex along with sublingual methylcobalamin? I know I needed the B12 because my gums have stopped bleeding, but I'm older and mostly vegetarian. Yeah, you can. There's no danger in taking a Bcomplex along with the sublingual methylcobalamin. The biggest challenge with methylcobalamin, I'll just point out, Linda, is that most of them are made with corn, GMO corn, and many of them are made with non-GMO corn, but I don't recommend it. If you really want a high-quality, grain-free methylcobalamin, pick up methylcobalamin from Gluten-Free Society, because we actually was forced into formulating this particular product because I couldn't find a methylcobalamin that didn't have corn derivative in it. Not anywhere. I couldn't find it on any website. I couldn't find it from any carrier. We actually, in my estimation, are the first and the only company that produces an absolutely corn-free methylcobalamin. Okay, let's see here. Mint teas are okay, Barbara, so that no caffeine in mint teas, so no issue there. Let's see here. Karen says, I took metformin briefly and started having issues with my fingers hurting and locking within days of starting it. Yes, that CoQ10 deficiency can create that. That's actually a very, very common symptom of CoQ10 deficiency. June wants to know, better to take B1 alone or in a B-complex? Both. Depends. Everybody's a little unique in that regard. A B-complex is good. B1 works hand in hand with certain B vitamins. That's why I formulated Ultra B1, because it has some of the other kind of key B vitamins that it works with in it. But again, sometimes, I test, June. So when people come to see me in my practice, maybe their only deficiency is vitamin B1 and they don't have any other B vitamin deficiencies. In that kind of situation, I'm not going to put them on a heavy dose of B-complex. I'm going to put them on B1 as a standalone. But if they've got, 4 or 5 different B vitamin deficiencies, yeah, B-complex is very much indicated in that regard. Let's see, Marie says, how about B1 vitamin levels in blood should be? So again, don't waste your time with blood. Blood is a waste of time. If you're measuring the blood, you're basically, it's not worth the paper that you're going to print out the lab result on. Are all B1 supplements the same? Can you recommend any that are safe? Mary, I think I answered that question with Ultra B1 earlier. That's what I recommend, especially those of you following me that are trying to follow the true gluten-free lifestyle, because we take great pains and efforts into making sure that everything matches and fits your needs in that regard. Let's see, Nancy wants to know, is it possible because of the B1 effect, menopause and sleeping, I'm not sleeping more than 30 minutes before I get woken up by hot flash and my IBS is crazy. I eat good. I follow your book, but no meat. There's a lot of things there, Nancy. It could be the no meat issue. If you're not sleeping well, remember that you need certain amino acids to produce the neurotransmitters of sleep. And so, for example, if you're not eating meat and you're not getting adequate tyrosine, if you're not getting adequate methionine, those could become problems for your neurotransmitter production. And that may be part of what's happening. But it could also be vitamin B1 as well. Terry says, I'm diabetic and have psoriasis. Is there anything that will help get rid of the psoriasis? I'm also severely allergic to gluten and wheat and highly allergic to egg white. Yeah, I mean, psoriasis is autoimmune, Terry, and as any autoimmune disease, you've got 4 primary triggers that you should ask your doctor to investigate. Number 1 is food. Sounds like somebody's investigated food because you have some idea of some things you're allergic to. So food is a trigger. Chemical exposures are a trigger. So the chemicals in your hair care products, in your soaps, your detergents, your shampoos, those things can be measured. Okay, and then you want to know about your microbiome. So measuring your microbiome and any kind of gut dysbiosis or microbial abnormalities within the gut, that can be a trigger. And then nutritional deficiencies can be a trigger. In my experience with psoriasis, a lot of times people respond really, really well to zinc. A lot of people with psoriasis have zinc deficiency, have B vitamin deficiency. So, those are all just possibilities. But again, the best way is to test. Test, don't guess. And that way you don't have to struggle with that psoriasis indefinitely without any kind of reprieve. Let's see here. Okay, Betsy wants to know, is there a connection between vitamin B deficiencies and alcoholism? Absolutely, Betsy. Alcoholics, Korsakoff, let's just say it like this. Alcohol causes B vitamin deficiency, period. In B1 for certain, Wernicke-Korsakoff syndrome being, one of the examples I mentioned earlier. But beyond that, alcohol induces B vitamin deficiency. And one of the reasons why is you need B vitamins to metabolize alcohol. So remember, your alcohol converts to acetaldehyde and then the liver has to take it. And there are several enzymes and there are several B vitamins that drive those enzymes to help you break that alcohol down so that you can properly excrete it and metabolize it out of you. And most of those enzymes require B vitamins, which is why alcohol is so detrimental to B vitamin status. Let's see, Linda, I'm 66 years old and have never experienced hot flashes. Is this normal? Hallelujah, high five, Linda. Yes, it's very normal. It's not necessarily abnormal to not have hot flashes. A lot of women have menopausal symptoms of hot flashes, but they have them because they have abnormal health. So it's not necessarily normal to have hot flashes. Okay, let's see here. Is there any link between vitamin B1 deficiency and Hashimoto's disease? More hyperthyroid than Hashimoto's. So that's not to say that B1 isn't important for metabolism, because again, the thyroid runs your metabolism and helps you basically turn up the furnace to drive energy and energy production. And B vitamins play a role in that, but there's a greater linkage between hyperthyroid, Graves' disease, and vitamin B1 deficiency. Nothing I've come across on Hashimoto's to show a direct correlation. Plenty of indirect, but no direct correlations. Let's see here. Naomi says, is this the same for rheumatoid arthritis? Basically the same test that you just mentioned? Yes. So again, we're talking about triggers for autoimmune disease. So those of you who may be new to the Dr. Osborne show, Fundamental 101, go get you a copy of No Grain, No Pain, because the final chapter of the book, I talk all about functional medicine and why it's important and kind of the testing, and I spell it out in much, much greater detail. Think of that as your kind of your roadmap or your blueprint to autoimmune, to a natural approach to overcoming autoimmune versus, you know, the plethora of steroids and pain medications and the plethora of immune suppressing drugs that so many people get put on. What's a good vitamin protocol for concussion? Well, Dodie, to answer that question, the best protocol is to get with somebody who's knowledgeable about concussions. But one of the things that you definitely want to make sure that enough is happening is omega-3. Omega-3 fatty acids are critical for concussive recovery. And if a person is omega-3 deficient and doesn't have enough, it can really create some problems. So that would be one that you can definitely look into and read more about. But get with somebody who's qualified. You know, it's hard for me to give specific advice because I'm a big tester instead of a guesser. I hate when people come to my office and say, Dr. Osborne, what should I do? What should I do? I should say you get tested, because if you get tested, then we'll know exactly what you need to do, as opposed to, why don't we try this for a while and hope it works? Maybe it will work. Maybe it won't work. Maybe I'm right. Maybe I'm wrong. Guessing only goes so far. If you're in a concussive state, if you're worried about brain damage and you're worried about recovery, get with somebody who's an expert. You don't want to mess around when it comes to your brain recovery. Okay, let's see. So Kelly, the same question coming up over and over again. The 4 triggers that I'm speaking about for psoriasis, for autoimmune disease, is it the same for alopecia? Yes. So this is something I'm glad I'm getting all these questions, because a lot of you have chimed in, and what it tells me is that you're listening, you're paying attention, and you're actually learning. I've said this, I can't tell you how many times on Monday night, which is, doesn't matter what autoimmune disease that you have. If you don't start by looking at those 4 triggers, you'll never find a solution. You will only find more medicine, more potential side effects from the medication, and you'll never find a curative measure. No drug cures autoimmune disease, because autoimmune disease is not caused by a drug deficiency. Autoimmune disease is caused by triggers. And those 4 categorical triggers that I keep repeating over and over every Monday night for you, that's where you have to start. Those are fundamentals. If the fundamentals are in place, then if you're not experiencing improvement, if you're not getting better, then you can dig deeper. But those fundamentals have to be addressed first and foremost. Okay. Luana says you should make audiobooks so I can listen while doing everything else. Hard to sit still. Life is crazy. Luana, No Grain, No Pain. It's in audio format. Go to Audible, pick it up. You can also order it on a CD and pop it in your car. So either way, you've got options. And then you can also tune in to my YouTube channel with your earbuds in while you're running about, while you're doing your day. You can watch as many of those without watching them. You can listen. Okay. Just got on. What are the 4 triggers? Jennifer, love it. The 4 triggers: food, chemicals, nutritional deficiency, and microbial imbalance. Very, very simply put. You want to know more? Read No Grain, No Pain. Look, I can't emphasize. I know that I don't want to make this show sound like a pitch for my book, but really, if you haven't read my book, you're coming to class unprepared. You'll get the most out of Monday nights if you've got your copy and you've read it. You'll get the most out of the information that I'm presenting because it'll all make better sense. Let's see, B1 for vegan. What do you recommend? Lisa wants to know. Lisa, I recommend if you're a vegan, get tested with your doc once to twice a year, as long as you're a vegan, with your B1. Again, these two things here, measure in the cell or erythrocyte transketolase, both good tests. As far as like, if you're just trying to supplement with just kind of a preventative kind of measure, take Ultra B1. You can take anywhere between 1 and 2 a day is a pretty decent, non-super high dose that will get you some B1 in your day-to-day diet to support you. Are there other nutrients that are needed together with B1 to manufacture acetylcholine? Yes, there are. So what are they, Phil? That's a great question. The other nutrients necessary to manufacture acetylcholine, number 1 is vitamin B5, also sometimes known in biochemistry as acetyl-CoA. Vitamin B5, pantothenic acid. Number 2, vitamin B12. In order to make choline, you need vitamin B12. There's actually a metabolic process where choline is produced as a result of a chemical reaction that is vitamin B12 dependent. So those are really critical. B5, B12, and B1 all help you make choline. Now, choline can also be eaten. You can eat choline. Choline is a B vitamin-like substance, and although you can make it, so the definition of a B vitamin, generally speaking, and this isn't 100% true, but it's mostly true, is that it's an essential nutrient that you have to eat. You can't produce it from other things that you eat. You can only get it from the food that you eat. Choline doesn't fall under that category because you can actually metabolize choline or synthesize your own choline, but you can also eat choline in food. And one of the richest sources of choline in the diet is egg, particularly egg yolk. And then if you like organ meat, choline is found rich in organ meat, especially if you like chicken backs and you ever pop the back open and there's that long spinal cord in there. It's really tiny, but it's very, very rich in nutrients. And you can pop that in if you can stomach it or overcome kind of what a lot of people struggle with, which is the mentality of eating a spinal cord. What about using nutritional yeast to get B vitamins? Not a big fan of using nutritional yeast as a sole source of B vitamins. And the reason why, unless you're growing your own yeast at home, most of the processed nutritional yeast, there's a lot of chemicals that go into the processing of nutritional yeast, and that's one of the reasons I'm not a huge fan of it. I can't find organic beef liver in my area to get my thiamine. Can taking beef liver capsules replace adequately? It's a great question, Dwayne, and it depends on how they were processed. If they were cold freeze dried, yes. If they were heat processed, again, remember that I showed you that slide earlier, that vitamin B1 can be destroyed by some of the heating process. So it depends on how they were processed. Carlene says, my daughter has MS and takes Tecfidera. Does this cause a vitamin B1 deficiency? Not to my knowledge, it does not. But the bigger question, Carlene, is why does your daughter have MS? MS is an autoimmune condition. And, I would highly encourage you to encourage your daughter to look at those 4 triggers that I've been discussing in the last 10 minutes. What beta blockers I'm not understanding your question, Keith. What beta blockers do they deplete B1? I think what you're asking me is, what do beta blockers deplete? Beta blockers can deplete zinc and CoQ10. There's no research that I've ever read on vitamin B1 depletion in beta blockers, so I can't say for certain that there's a correlation there. Do you have more information about seizures? I've got lots more information about seizures. If you go to glutenfreesociety.org, I've got a number of articles about leaky brain, and I've got a number of articles about gluten-induced seizure disorder. As a matter of fact, and every time I've ever seen somebody with a diagnosis of epilepsy, gluten was always one of the major contributing factors. So if you are suffering with seizure disorder, if you know somebody suffering with seizure disorder, it's time to really think about getting genetically tested for gluten sensitivity. Very, very important that you get genetically tested if you really want to know whether going gluten-free is the right move, because the blood tests for measuring gluten are not all that accurate. You can get a lot of false negative type of results from blood tests. So genetic testing is where I would recommend that you start. Karen says, thank you for no grain, no pain. Husband feels tired, muscle pains and swelling in feet. He has congestive heart failure and AFib. Will B1 help him with tiredness and feet swelling? Karen, it will if his problem is being caused by B1 deficiency. So again, without knowing why he has congestive heart failure, it's hard to comment on that. And again, going back, if he's got a doctor he's working with, the very first thing I would ask him to do is run testing for vitamin B1 deficiency, but don't stop there. Ask him for the whole gambit. Tell him you want to know about all the B vitamins, because if he's got AFib, he's probably on some types of medications to control it. If he has congestive heart failure, he's probably on the diuretics. So the B1 deficiency may not have caused his congestive heart failure, but the diuretics, let me find out where I think I erased it. Yeah, it was over here. So remember the diuretics I was talking about earlier, the diuretics cause vitamin B1 deficiency. So sometimes people develop congestive heart failure for different reasons. There's a lot of things that can cause congestive heart failure. For example, CoQ10 deficiency can cause congestive heart failure. And so if the doctor says, oh, you have congestive heart failure, we need to get you on a diuretic. But the doctor doesn't say, I wonder why you have congestive heart failure. Instead, he just medicates you, and the medicine creates a deficiency that also causes congestive heart failure. This is where B1 might help your husband. But again, don't play around with it. Get him tested, because if you don't get him tested and you give him just a B1 supplement and he doesn't get any better, men are funny. And I can say that because I am a guy, right? We will not go to the doctor unless we have a limb hanging off by a thread. Like, we try to avoid the doctor at all costs. There's a distrust issue in many men, and there's a stoicism in many men. It's just like going to the doctor is a sign of weakness, and men don't want to feel weak and they don't want to seem weak. So if you convince your husband to overcome that stoicism, and again, I don't know your husband, but let's just say he's a stoic, then you get him to take this B1 and it doesn't work, then he's going to feel like let down, and he's not going to be more apt or more open to explore other avenues. So if you're going to get him to open the avenue of exploration, open it wide up. Don't go halfway, go all in. Okay, let's see. I answered that question. I've taken B vitamin supplements in the past. They actually caused me to feel anxious. What would cause that? You may not need them, Lisa. Some people, this is a great point. Some people don't need B vitamins, and taking more actually creates anxiety. So if you're that kind of person, you might consider that B vitamins are not necessarily the best move for you supplementally, and that get them from your food. Not everybody responds well to supplementation. Okay. Whew, we just finished up with an hour. So you guys know the drill. If you haven't already, hit the bell and subscribe to the channel. The bell will send you notifications every Monday night before we go live. Also, make sure you subscribe to my channel on YouTube. That's youtube.com/glutenology. And if you haven't already, come visit me at glutenfreesociety.org. That's my foundation, where you can learn all things how to go gluten-free the right way. Not the wrong way, not the sick way, but the right way. Come visit me. Sign up for our free newsletter, and I'll send you a wonderful series of free gifts on how to go gluten-free the right way, with some other fantastic health and nutrition resources. Well, thanks so much for sharing your Monday night with me. I look forward to seeing you again next week, 6 p.m., same time, same channel. Have a fantastic week. Hey, don't forget to tune in next week, same time, 6 p.m. Central Standard Time, for another Pick Dr. Osborne's Brain show. Bring all your toughest health questions to me. I look forward to answering them. And before you leave today, make sure you hit subscribe. And once you do, click that bell. That bell is going to allow us to remind you right before we go live. But it's also going to allow us to remind you when we come out with other video content all week long. We've got lots of episodes coming your way all week long, and I don't want you to miss anything. So again, subscribe, hit that bell so that you can get notified when we have that new information put up for you. Thanks so much, and I'm wishing you excellent health. Have a great week. We'll see you next Monday night.